Very good morning. I'm Dr. Krish Bab. Today I'm here to talk to you about the subclavian artery. It's of immense clinical importance. Numerous surgical lesions, correctable lesions are there in the area where it traverses through. It has three parts. The first part medial to the scalenus anterior muscle. The second part goes underneath the muscle. The third part is outside of the muscle to the outer border of the first rib. It's easier to remember like this. The branches are 3, 2, 1 in that order. First part 3, second part 2 branches, the third part a single branch. Whereas you find the reverse in the case of the axillary artery. The first part 1 branch, the second part 2 branches, the third part giving 3 off. The first part, before it goes underneath the scalenus anterior muscle, it gives 3 branches. The vertebral artery, the internal mammary artery, and the thyrocervical trunk. The vertebral artery proceeds upwards into the intervertebral foramina, into the skull, to take part in the circle of Willis. The internal mammary artery descends downwards behind the anterior chest wall. It is the artery, it is favorite artery of the cardiothoracic surgeon to give the favorite Lima graft. A Lima graft to the LAD is a boon for people who have got ischemic heart disease. In clinical practice, I have seen gentlemen surviving 25 years after Lima graft. Such is the patency and the faithfulness of the graft, thanks to the cardiovascular surgeons. Third branch is the thyrocervical trunk. It again, in its turn, gives 3 branches. The inferior thyroid artery, the transverse cervical artery, and the suprascapular artery. These are all muscular branches. Of course, the inferior thyroid goes to the thyroid gland, the transverse cervical, and the suprascapular deep into the cervical muscles they supply. Once it goes behind the scalenus anterior muscle, it gives off 2 branches. The superior intercostal artery and the deep cervical artery. These are situated deep to the scalene muscles. Sometimes while doing biopsy of a supraclavicular node which is deep seated, troublesome bleeding occurs because of injury to these vessels. The third part, when it comes out of the scalenus anticus muscle, it gives off a single branch which goes directly posteriorly downwards, called the dorsal scapular artery. It will go directly and accompany the dorsal scapular nerve to the rhomboids. You remember the brachial plexus. So it accompanies the dorsal scapular nerve and it goes and supplies the back muscles over the scapula. The subclavian artery can be blocked in various sites, near the first part, behind the scalenus anterior muscle, as well as in the third part. The various thoracic outlet syndromes are described. The cervical rib, the costoclavicular syndrome, the scalenus anticus syndrome are all the various manifestations of thoracic outlet syndrome. If the subclavian artery has got too much block at its origin from the aorta, it can cause a subclavian steal syndrome as well. What is subclavian steal syndrome? If I got block of my left subclavian artery, if I keep doing this pumping action for 25 to 30 times, I am likely to have a syncope or pass off because of the vertebrobasilar insufficiency. There is a block, my arm needs enough circulation when I am doing exercising, it is not able to deliver the blood flow from this vertebral across the circle of Willis, descends into this vertebral and then supplies the left upper limb, as a result of which there is a deficiency in the intracerebral circulation, which causes syncopal attacks. Such is the importance of the subclavian artery. One ought to read and know about it, especially the thoracic outlet syndromes, the scalenus syndromes. Baseball players who call themselves pitchers suffer from thoracic outlet syndrome, and many of them have got it surgically corrected as well. NHL league players, famous wrestlers, bodybuilders, all suffer from thoracic outlet syndrome. Not all of them, some of them of course, suffer from thoracic outlet syndrome, which is surgically corrected successfully in them. Thank you for the day, for listening to me.